Welcome back, everyone, for another episode of Q&A with Sharon's son, George. Today, I have an incredible individual, really somebody who I admire and spearheading the world of medicine for hope for a cure and also for awareness in the Parkinson disease world and community. From the Norman Fixel Institute, who I had the honor to meet Mr. Fixel at the University of Florida Health and co-author of the book Ending Parkinson Disease, which I have here. If we can there you go. I read it actually. And prescription for action. I just want to welcome Dr. Michael Okun, but before I give the floor to you to introduce yourself, I just want to thank you for your support, your time, and your love. I mean, anytime I ever even reached out, it was you right there within minutes. And it's just someone like me, just really trying to change the world. Having you by my side and together, our voices are just so much stronger. Just want to thank you and welcome you to the show.
Oh, it's a pleasure to be here. You're a big fan, really just in awe of the things that you're doing to just create awareness. And, we need so much more, together with the voices. So I love that idea of putting our voices all together as a Parkinson community. So if we're going to make change. We gotta get together more. So what you're doing is so important. So thank you for having me today.
No, I appreciate it. And again, towards the middle, I wanted to share a little bit about, the interview you did with me before, also your incredible work and the book too. So let's jump right into it. Maybe you could tell us a little bit about your background.
Yeah, so I am a neurologist, by training, and I am very interested. I've always been fascinated with why people move in different ways, or why you might have a tremor or stiffness or slowness. And I love the brain, which is still the world's best supercomputer. And in very brief terms, George, I was thinking of being a history professor and sort of switched up and decided to do medicine. And I'm absolutely passionate about this area and have done a lot of research on the circuits called the basal ganglia that are just so important to underpinning or the causes or what we think are the causes of diseases like Parkinson disease. And we develop a lot of new technologies. We work on a lot of research. We see a whole bunch of patients, and we say persons with disease, at the Fixel Institute. And it's our honor, and they drive us and they help us to kind of decide what it is that we need to be working on. And so I never saw myself in research, but here I am. I do research, I see clinical, do some teaching here at the University of Florida. At the Fixel, and it's an honor to be here, and we hope to make as much impact on this disease, Parkinson, as we can.
I have so many questions. I hope we have time, but who do you turn to in your days where it must not always be easy because you're dealing with some incredible people, people who come to you for help, and obviously we can't always give them the answer they want, which is the cure yet. I know it's coming soon, but how do you have a support? Like, who's your support? I want to get inside the real world of, Dr. Okun, because I know everyone sees kind of the outside and the incredible. I mean, I follow you on every social media. I know we share each other's information because it's so amazing and inspiring. But is there someone, your support through the tougher times when maybe you leave the office and think in your mind, well, maybe you can say what you think, but I know if I was, that's the only degree I didn't get is the MD. I went for the law degree, the PhD in criminal justice and police officer, but I just imagine, some of the tougher times you might have that you might not talk about a lot, maybe you can touch on if you'd like.
Yeah, so it's super important. We all have support systems and support networks, and I will say one of the greatest gifts that I've had is just being associated with a multidisciplinary team, and an interdisciplinary team where we gather around the person with the disease, and that it's bidirectional. So we talk about this model. We've published it in the journal, the American Medical Association's Neurology. So there's a journal called JAMA Neurology called a service and science hub model, but we call it bidirectional because even though we all, orbit, and people hear me say this over and over, so I'll just say it and get it out of the way. Person with Parkinson is the sun. We should all orbit around them. In that model, it's bidirectional, and we set it up bidirectional. So we get as much from the relationship as do the people that we treat. And then there's a group around us providing that support, for the person that's the sun in the center. But together, we provide each other support. And then, of course, I have the great privilege. I have two great kids. I have a Latin nerd and I have a chess nerd. And we're not very coordinated, the Okun family. I know that's going to surprise America and beyond and all the continents to hear that. We're not like super coordinated. So we're mostly nerds. We read, we spend a lot of time together. I have a great wife and I have a great dog, and my dog is named after a brain cell. We always name our dogs after either brain cells or brain chemicals. Our latest one is a brain chemical, and that's GABA. And so we provide good support. And I'm into my third decade now, so I've seen people on this journey, and it's inspiring, for me. But definitely, I think everybody in healthcare needs to have support, and we really learned a lesson during COVID, George, in that if we're not supporting our nurses and our team, and they need support. I mean, being in healthcare, it's humbling. Every day I learn something new, but also the pressures can also be immense. And so creating teams and moving those chess pieces as multidisciplinary teams really, I think, helps. But I think it's a great question.
Thank you. And I'd like to thank your staff also, because again, they're all just so incredible when we speak and talk. I feel like they're family already. Probably don't want to tell them that because then they'll think I'll be contacting them all the time. But I really appreciate everybody and your whole entire family for supporting us in this fight. Maybe now we can shift to I actually learned more about you and Dr. Dorsey and Dr. Bloom and all about your world when I don't read a lot. Obviously, you probably know when you're doing your PhD or your medical school, it's like you think you're never going to read or write again after that. This book inspired me. Really, I learned so much. So maybe we can kind of jump into the book, how it came about, and any other information. And please, everyone listening, please support the doctor and his work. Share his information, follow him. Some of the posts are not always easy, but they're so important. I see a lot of the patients and stories you share, and my heart breaks sometimes, but then it actually feels knowing that you're out there fighting for everyone. So let's jump maybe right into the book, because this is very important to me.
Yeah, so I had the pleasure of working with Ray Dorsey, who's up in Rochester, New York, Boss Bloom, who's in Nijmegen in the Netherlands, and Todd Scherer, who's the former CEO and still works in strategy for the Michael J. Fox Foundation, and just a great crew. And as we embarked, on the book and the book project, and as a team, talked and did a lot of research. One of the things that was kind of a looming question. Well, first of all, I love to write, so I'm a writer. I've written a lot of books and a lot of papers, and it turns out more people read that book that I wrote called 10 Secrets to a Happier Life with Parkinson than any of the hundreds and hundreds of papers that I've written. So it's a big lesson, right? Like what kind of impact you can have. And so when we wrote Ending Parkinson Disease, one of the big, looming questions for us is, what does it mean to cure a disease? Have other diseases been cured? What's the path? Like, where do you even start, in terms of thinking this, this construct, this problem, kind of all the way through. And so we studied HIV, George. We studied cancer. We looked at other disease states. Polio was one, and we wrote this book before COVID-19, and it sort of came out concurrent, like almost on the same month that COVID appeared. And the original title, believe it or not, was The Parkinson Pandemic, which was a little quip that I had in a 2013 book about how Parkinson was expanding, kind of like an infectious disease. Pan means all, demos means people, and so that's where the word pandemic came from. We don't tend to use the word pandemic to talk about, other diseases that aren't infectious. But, gosh, if you look at the largest growing, neurological disease, it is Parkinson now, believe it or not. It's not Alzheimer's, it's not brain tumors, it's not strokes, it's Parkinson disease. And so in that book, we were really interested, George, in trying to understand what were the things that other people have done when they try to get out in front, be preventive, be proactive, be practical, and what are the journeys, what were their lessons kind of along the road. And we came up with this idea that success for others has been really packaged in something called the PACT: prevent, advocate, care, and develop new treatments and research. And so when you think about that, that is really the path that others have taken, and we need a much greater advocacy effort. And one of the reasons that I love being on with you today, and I love the fact that you're nonstop on social media, like you post like crazy. You can't post enough, Ackerman. Like we don't have enough people that are out there pushing this. I mean, when we have the PD Avengers, which really grew out of that ending Parkinson disease and really embraced it, and it exploded into thousands of people. We don't need just thousands. I mean, that's awesome. But the voice that we need, grassroots, George, is hundreds of thousands, millions of people jumping on board. And so we really need more people like you out there, to do this. And this was really important to create inflection points in cancer, to create inflection points in HIV, to create the change in polio. And so advocacy is, one of those components of the PACT. It's the A. So we learned a lot from writing that book.
Yeah, one thing I enjoyed is it also kind of gives people who want to go into the field of advocacy a method and some tips on how they can get involved. Because as you know, in any book, it's great to have a plot, a whole story, but you need some action, and that's what I really enjoyed. Motivated me to keep fighting. I probably need to see you for how to slow down a little because my biggest downfall is even as a caregiver. I just didn't want to look back and regret anything with my mother. And I could tell you now, I don't have any regrets except the cure wasn't found in time. But even as shifting today to advocacy, unfortunately, I often put my own health in the back burner because every time I see a post where someone's struggling or, even meeting Mr. Michael J. Fox a second time this weekend at the Unity Walk, which I really hope we meet one day. But seeing him struggling still kind of drives a stake in my heart and pushes me to never give up. And I'm having my own third back major surgery, spine surgery this May 21st. I could tell you, no matter if I'm from the bed right out of surgery, I'll be fighting back on the front lines for Parkinson's awareness because I just don't want, as you are again an expert, I don't want people to have to go through this anymore. That's what keeps pushing me. But when I'm alongside
You know,
with
I'll
you,
just add to that, and let me just jump on, dogpile on to
I
your
love it.
thoughts. So one thing I think that for those that are listening today is a number of years ago. So I've been working with the Parkinson Foundation as a medical director and medical advisor since 2006. It's been an honor to watch all the centers of excellence and everything. We've learned a lot, and we created this database that's kind of the largest real world database for Parkinson disease, and care. And it's been kind of a cool project. And early on, there was a nurse and a nurse PhD, a doctor nurse, awesome, named Julie Carter. Julie's retired now. She's still around. And she's amazing. And she's up in Oregon. And she added, as part of one of the components, the multi-caregiver strain index. Okay, at the beginning of that, we started to look at how much strain, carers, like you're describing with your mom, were under it. And we were like, I don't know why we were shocked, George, but we were shocked. Like when we saw the data, like we should have been like, oh yeah, of course. But you collect the data, you look at it, and you realize much more than half of people at any one time, any snapshot in Parkinson disease, more than half of the people have serious caregiver strain. Okay, because it's so hard, to care for people. And it matters if there are differences between men and women carers. There are differences, in socioeconomic classes. There are differences in access and everything. But all in all, it's such a huge problem, so huge, such a big challenge. Let's call it a challenge instead of a problem. Such a huge challenge that I changed the way that I approach people in the clinic. And even when we have trainees come and we're seeing folks together and trying to take care of them and create plans, they're always shocked with how much time I spend with the care partners, the caregivers, and the family, and asking them, are you okay? Do you need help? Would you like a licensed clinical social worker to work with you? Are there things that we can do and support along the way? Look at the data, and then also the data tells us that the health of the care partner and the caregivers directly correlates with how good you'll do with your Parkinson, how often you'll go to the emergency room, how good you'll do in outcomes and things. And so, we just completely don't pay attention to this stuff. And so I know it's really important. And a lot of us work in the lab on, developing treatments and all this other stuff, but just as important, think about it, blow your mind, right? More than half of the people have serious caregiver strain on a validated index that Julie Carter put into this study. And I just think there's so much for us to learn from that.
Yeah, I kind of before my world of caregiving, because you don't take a course, so it's kind of just tossed in, just like a new lawyer, or a new police, or a new doctor. Before the world of caregiving, I advocated for family members of homicide victims. So in the criminal justice world, a lot of times, unfortunately, the victims are no longer with us, but the family becomes secondary victims. And I kind of correlate that in my view, and I could be wrong, but I didn't obviously I wasn't diagnosed with Parkinson, but I felt like I almost had secondary, you coined the term Parkinson, because I was sitting with my mother, struggling with my mother. Yes, I didn't feel the actual diagnosis, but I did feel that I went through, unfortunately, every struggle that an individual, at least in my mother's journey, did, and it was kind of heartbreaking at the same time. And I appreciate that you even give some more time to the caregiver. It means the world.
Well, and there's a transference phenomenon. And there's a shortage, by the way, of counselors, social workers. There's a shortage of mental health, folks, psychiatrists along the way. And there is a known phenomenon of transference, transference of things when you sit with somebody for a long enough time who's suffering and you're a full time, that it begins to become your world as well as their world. You become one, you meld, especially if it's a family member, right? Husband, wife, son, daughter, cousin, whatever, you become one, and it can be an intense experience. And so both during the time that care partners and caregivers are going through this, they need support, and after the experience, they need support. And it's an opportunity when we work with families, George, it's an opportunity for us to say time out to families. Because a lot of times what happens is, and I tell families, you have a choice here. You can become closer or you can become further apart. And sometimes families, I know this might shock you, but sometimes families are not that close to start with for whatever reason. They've moved to different places, they've had different things. But there could be an opportunity, I always tell people, for you to come together around a common cause, and it can become a really special and meaningful journey. And so sometimes what appears to start out as, oh my gosh, the family comes in and they're all on a different page, if you can get them together, and believe it or not, this has been something that Zoom and all of these, types of new technologies, Skype, was early on Skype when we were in the Philippines providing care early in the 2000s, Zoom technologies, Microsoft has a technology where you can actually put people together during the appointment. You can Zoom them in, even if they're not there in person, and have people, appreciate the opportunity to come together and then to sometimes get therapy. And I will oftentimes recommend that families get therapy, together without the person with Parkinson, at least initially, and sometimes, without them, just together, to come together. And it's such an opportunity, for people, and can be life-changing too, and reuniting for those families. And so, I can't stress enough how important that journey and how that aspect of the journey is.
I appreciate it. And then I wanted to move to living with Parkinson's. Maybe you can discuss, obviously, that's probably a very important topic in your career and life. So maybe we can discuss that. And you also mentioned 10 secrets to a happier life. I don't know if we have the time to hit all 10, but maybe we can touch on a few, because there's just so much incredible information that I wanted to learn too. Because everyone I meet every day, I learn something new. So no matter, despite what my law school professor said, I still learn a lot. So I appreciate you sharing that with us.
Yeah, absolutely. Well, when we talk about living with Parkinson, I think one of the most important things, and also the 10 secrets, and maybe meld some of that together. One of the most important things for folks to take home is that when you hear those words, you have Parkinson's disease, okay? You have Parkinson's disease. When you deliver those words, it is going to be a memory for them forever. It's like it's going to like burn into their brains, the moment, the time, the everything. And so one of the secrets is to know that, lots of people out there, don't know what Parkinson is, don't know it has many subtypes, don't know it has so many treatments, don't know how, there can be lots of meaningful paths to a great life with Parkinson. And so they immediately, will equate it to Alzheimer's and ALS and brain tumors and everything. And it's different. And, and no disrespect to Alzheimer's disease, which is, also something that we see in the clinics and in neurodegeneration, but it's completely different than Parkinson's disease. And so, helping people to understand what it is and not deflating their hope. There's a realistic way to talk to people, but there's so many things. We have so many treatments. And so shifting into living with Parkinson, we have so many things that we can do, for Parkinson's disease now that that can create meaningful lives. And people need to know that just because you have a diagnosis of Parkinson doesn't mean that you can't have a meaningful and great life. You totally can have a meaningful and great life. And we have folks who are diagnosed, George, who tell us that their lives are better. They start to exercise more because exercise is good for Parkinson. They balance their lifestyle. Their families become closer. They become more focused. They feel meaning. They refocus their lives. Those who are working refocus, some of their careers. And so, the secrets to living with Parkinson's disease, are how to reach that level of Zen, because stress, anxiety, sleep deprivation, they all make Parkinson's symptoms worse. And these circuits in the brain I told you about that for some reason I began, studying and becoming super interested in, called the basal ganglia. These circuits, they're driven by stress and anxiety and sleep deprivation in the wrong direction. And so, one of the secrets is it's not just drug dealers like me that are neurologists that are going to help you. It's having that team of people around you, occupational therapists to help you to integrate with your activities of daily living, physical therapists, having an exercise plan, and not just a plan, George, but a real plan that people are checking on you, something that fits you, that's tailored to you, not just saying, oh, I need to exercise once a day. It needs to be more than that. That's important. Speech therapy, super important. And so making sure we integrate the right plan for folks, and we know it's dynamic, it's going to change over time, and making sure that folks, have access to good information, they have a plan, they're adapting the plan as their Parkinson changes, and they can be very successful, at this journey of living with Parkinson's disease.
You kind of touched on it. Maybe as I'm going to share a screen, if you don't mind, of some of your work in the Fixel Institute, but maybe you can touch on some new therapies and maybe innovations. I know the big one happened a year ago with Michael J. Fox Foundation, the biomarker. I try to explain it, but again, I'm no medical scientist, so it's kind of, I believe it's a major needle in the spine that could help, early diagnosis for Parkinson, but I know most people don't want that giant, needle. I'm already having enough spine surgeries, and I know some, I heard you could probably touch on it. They want to take that technology, bring it to regular doctor's offices as a simple form of blood test. Maybe you could correct me or just discuss some other major breakthroughs that are coming.
Yeah, so what folks need to know that are on Main Street, about this is exactly as you said. What's the simple, kind of background about, kind of what's going on with these, sorts of tests, and why are we interested in them? First of all, it's super important to know whether you have something or you don't. And the best diagnostic test for Parkinson's disease is actually seeing a neurologist, being examined, and then seeing how you respond to the therapy, okay? And that is not going to be a good long-term practical way for us to classify people, get people diagnosed early, get people the right types of therapies, and roll people into clinical trials so we can address, the different therapies that might both treat, so we call those symptomatic therapies, or slow down disease, we call those disease-modifying therapies. And so, the reason that folks got super excited about, the paper that came out, from the Michael J. Fox Foundation about a biomarker is, as multiple of these groups look at biomarkers, and that could be any fluid. So it could be fluid out of the spinal fluid. So you talk about a spinal tap, and of course, nobody really wants a spinal tap, but there's fluid that bathes your spine and your brain. So good to start there. So if there's a signal in that fluid that can help us to identify or maybe even one day track Parkinson, super important. Blood would be even more practical. Regular MRIs that we get all the time, even more practical. And so putting together and thinking of ways that we can classify this, if we can actually make a diagnosis and track the disease over time, the number of people that we need to treat in each trial when we trial new therapies goes way down. Okay, it could go from tens of thousands to hundreds, okay, that we will need to trial. So having a biomarker is important for driving new therapies. And here's the good news. You talked about people don't want spinal fluid. Well, on the Twitter feed here just in this last week on Twitter and Instagram, was talking about all these papers coming out with blood now, blood biomarkers, and then a blood progression, marker, and lots of people working in this area. It's like Genesis. It's like the first page of the Bible, George. And what we're seeing now is, lots of groups kind of racing to become more practical. There's a study for the Parkinson Study Group and the National Institutes of Health with David Valancourt looking at regular MRIs that'll come out soon. And so there's a large multi-center efforts like the one that David's working on where people are looking at more practical things. And why is practical important to biomarkers and diagnosis and disease progression, not just for clinical trials, but also across the globe? You want people in every continent and every socioeconomic class to have access to these things so that everybody can benefit. And so that's when people talk about biomarkers, they're looking for something that can measure, perhaps diagnose, and perhaps track disease progression. And then there's an argument, a debate in the field, and I don't want people to get upset. Scientists, we should debate ourselves all the time. We should never be too sure of ourselves. And there's a debate about what's going to be the best biological classification. Will it be a spinal tap? Will it be blood? Will it be a DAT scan? And will it be a skin biopsy? Will it be a combination? Probably a combination, folks, of multiple of these tests. And then we look to cancer, which has a TMN staging, tumor metastasis and node staging system. Alzheimer's has an ATN classification, presence of an amyloid protein, presence of tau, presence of neurodegeneration. So it's a question mark. What will Parkinson be? And people shouldn't panic. People should be excited that there's a spirited dialogue among all of us about what direction we need to take, and we need to wait and see how that data is going to emerge. But it's good news. It's good news for trials. It's good news for the development of new treatments for Parkinson's disease. It's good news, kind of all around.
I think that's one of the most important areas you touched on, is just to keep hope alive, and that gives a lot of hope to so many. So thank you for that. Just want to point out, everybody watching, listening, and please share. ufhealth.org is where you can go to find more information on the doctor and all of his incredible work. We also have, this is the website for the book, so please support the doctor. It's endingpd.org, and you can see all about it. And then, of course, TogetherForSharon, if you click interviews, this is one of my favorite action shots of the doctor live performing here at his, I call it artwork. And this is an interview that you did with us. So I just wanted to reiterate, I really am grateful for that. Now I wanted to shift actually the final area, and then I want to just get a little bit about you and out of the world of Parkinson's, because people probably are curious, just who is Dr. Okun? Plus, you don't have to respond if you don't want to. This is the fun of the show. But
let's fire away. Blitz, let's do it. Let's do it, George. We're ready.
Before we hit to the end, as we wrap up, can you also talk about DBS surgery? Because I know everyone has an important choice. For my mother, just wasn't the fit. Maybe you could talk about what it is, who might be a potential candidate. I know not everyone is. I personally am for it. If we don't know still the genetics, if that's a cause of Parkinson. I actually was interviewing Dr. Dorsey, and he was telling me for the first time that even you're cleaning the chemicals. So as he was saying it, I was thinking of how can I take this jacket off and burn it while we're talking.
Right. Don't want to send it to the dry cleaner. Yeah. Yeah. It's a dangerous world though we live in. And of course, with, 80% of Parkinson, we don't know. It's not associated with a single gene, that makes us say, whoa, what's going on here? And could these exposures be something? And so Ray Dorsey and colleagues and other people around the country have really opened our eyes. And in the book, Ending Parkinson, big discussion on that as we write the cool book. There'll be more discussions on this topic. Super important. In terms of deep brain stimulation, what I want people to remember is just simple, just real simple, George. There are therapies that are symptomatic. So there are three buckets of therapies in Parkinson's. Symptomatic, those are things where, drugs, devices like deep brain stimulation or duopa pumps, pumps for Parkinson, pumps that go under the skin, the new subcutaneous pumps. So these are symptomatic. They help you with the symptoms today. Okay. Then there are therapies that we're searching for that are disease modifying. Okay. We're not sure whether we have any disease modifying therapies yet. We had a little bit of a debate here in the last week or two with the New England Journal of Medicine study that came out on the GLP-1 drug for diabetes. And so we're keeping our eyes on that, but it's pretty interesting. And then there's the last bucket, which people call the C bucket or the cure bucket, right? I'm careful about cure because Parkinson isn't one disease. It's Parkinson's diseases. It's multiple diseases. And so that last bucket, I call it the P bucket. Okay. Not because why you think the P bucket, but the P bucket for personalized therapy. Maybe you have a mutation in GBA or LRRK2 or whatever, you're going to take something that might address that specific. And then at some point we might hit on things that hit that whole degenerative cascade and really, either slow or really quell down. And so we think about the buckets. Deep brain stimulation is in bucket one. Okay. It's like very effective, just like a drug, but it's more effective than the drug therapies that we have once you develop motor fluctuations that's wearing off, or dyskinesias, or too much movement, or tremor. And then you start bouncing up and down from all of these different states all day long. Some of the people are taking meds every 2 hours or every 3 hours, and they just can't get stable. Boy, DBS, George, is a great treatment for motor fluctuations and for dyskinesia. So effective, such a great type of therapy, multiple targets in the brain that we can use. And most important, keep it simple. Make sure you go to an experienced center. You see a multidisciplinary team. That means you see a neurologist and they test you on and off your dopamine. You see a neuropsychologist for your memory. You see a neurosurgeon for discussion of the risks and benefits. Do you need one lead? Do you need two leads? Do you, what's the approach? How do we keep you safe? Is this the right therapy for you? And then also the rehab, types of people. So PTOT, speech and swallow. Many folks will have people see a financial counselor, make sure they're not stuck with a bill, a social worker, to make sure they have the right rides and support and social support. We have all of our folks who are going to DBS see our social worker and a nutritionist in some cases. And so all those people, they're going to sit down. You know what they're going to do, George? They're going to talk behind your back, because the highest level of healthcare is when people are talking behind your back. Maybe in other areas, not so nice when people are talking behind your back, but in healthcare, boy, if everybody evaluates you in a team, they talk behind your back and they say, are you a candidate for DBS? Here's the risks and the benefits. Here's what I think I would like to get better. And then we can have shared decision making. Here's what I think will actually get better now that we've done this thousands of times. And so it's not for everyone. Estimates are 15 to 20% of Parkinson folks at any one time might benefit from it. And it's just important that we have the right teams, the right experience. We keep people safe. And boy, when we choose the right candidates and we do this right and follow up, it can be life-changing. Okay, but it's not for everyone. So if you have problems with thinking, for example, we need to have a neuropsychologist look at you and see, is it too dangerous to be doing DBS? If you have problems with walking and falling, it's probably not going to make that falling problem get better. If you have problems with speaking, and particularly with the loudness in your voice, it might actually make that worse, particularly if you need two leads. Not everybody needs two leads in the brain. And so these are kind of the discussions. And then there's a focused ultrasound therapy where we can make a lesion in one side of your brain from outside the brain. And people are talking, could it be safe again to start putting two lesions in the brain? There's a duopa therapy. There's a patch therapy. There's a whole bunch of different devices. Most important thing, George, for folks, just keep it simple. What are the things that you want to get better? What's the track record of these things? What do we know about the data? We need to have teams meet, do shared decision making, and choose the right path for each person. So that's how I kind of think through these things.
It's amazing that we even have an option such as that, and individuals so incredible like you who can perform it. I mean, like I said, not to get in deep, but even 2 or 3 spine surgeries is frightening. I imagine the brain surgery for that individual choosing whether or not to do it is definitely life-changing. But I have seen the good side. I interviewed Dan O'Brien. He's incredible, former musician. He actually just had a charity event this Sunday here in Boca, South Florida. And he, on the podcast, he literally clicked the button off for DBS and he started uncontrollably shaking, clicked it on, boom, gone. And he's a big proponent of DBS. So thank you for sharing that.
Yeah, absolutely, 100%.
It's incredible information that, again, I can't provide. All right, so now it's a fun time. Just sit back, relax, and enjoy. And
All right.
you do. I'll be your attorney in this section. You can take the fifth. Just
Okay.
kidding. So, what is one moment or most memorable moment? There might be a lot, but one that stands out most through your work and awareness that you could share, or even through your medical career? Is there that? I know it's probably multiple, but maybe one, that shines in your memory.
Yeah, there are so many, and in my life, I've gotten to travel the world and see Parkinson folks on every continent, and see even with different languages how people are, how people will, be affected and how important it is. I think, the moment that I went to China and was doing a book signing in China, and I realized all these people in China didn't have access to books, to just, like information, they just didn't have it. And then that story repeated itself when I was in different countries. And I thought, holy crap, like I've been doing all this research, and then I started writing these books for folks with Parkinson and families, and how much it is needed just to put the information out. And so it always stuck in my mind, just hugging people with we didn't even have the same language, but we would translate these books into different languages, and how meaningful it was for people just to get information. I think that really stands in my mind.
Thank you. And likely someone listening right now may just have been diagnosed with Parkinson's disease. What advice could you provide? I know you touched on it earlier, but is there any advice you might have?
Deep breath. Don't buy into, all of this, stuff. And if somebody was quick with you and said you have Parkinson, go see a neurologist, or you have Parkinson disease, get your affairs in order, or whatever, just put that out of your mind. We've seen so many tragically bad interactions for people when they first get diagnosed. This is a disease, it's not Alzheimer's. There's so many good treatments. Take a deep breath. Let's see if we can, what we can do to put a plan together to help you. And so many of the families and folks that we've worked with for so many years have found meaning and purpose in their lives, even with Parkinson. And finally, we're all going to get something in this world. Like if you think you're going to go all the way through your life without getting a medical illness, boy, like that's probably, you probably need to be thinking a little bit differently. And so we're all going to have things along the road. We need to help each other on the journey. We have plenty of resources to help you. And so think positive, and reach out and get to the right team.
If you were asked to write a script to a movie about your life story, what would you call it?
I'd probably call it the we journey and not the me journey. And that's just some learnings over the years from Muhammad Ali, and who has the shortest poem in the history called We Me. And it really makes you think about, it's not all about you. Okay, it's all about us. It's a shared journey. So anything about my life would be about other people's life. So it would probably be the we journey.
I mean, this question my wife said don't ask because we all know the answer, but if you could have one wish granted, what would it be? I still
Oh
have.
my gosh. Yeah. So, I mean, it's actually kind of a tough question, right? And across the different scales of, even if you wiped out one disease. So people say, oh, I'm going to cure Parkinson disease. Even if you wipe out one disease, it doesn't necessarily, Parkinson isn't one disease.
Okay.
So, what would I wish for? I would wish that everybody in the world, can find happiness and impact in their lives. Okay. That they wake up every day and they can wake up happy and feel like they're having an impact in some area, of their community and of their world. If people could do that, we're not programmed to live forever. hate to break it to everybody. We're not programmed to live forever. But I think if I could have one wish, it would be people wake up every day with that feeling of purpose and happiness. I get to wake up every day with that feeling. I would love it if everybody had that opportunity.
That's excellent answer. Last question. I know you have things you have to do also, and I mean, hopefully we'll continue and never know in the future. If you could leave the Parkinson's community today with some special words of encouragement, what would those be?
So my words would be this. Let's travel the world together. Okay. The Chinese philosopher Lu Xun said there were no roads. Roads happen when people walk together, decide to walk together on them. We need many more folks in this community with and without Parkinson to get on that road together. That's why I love talking with George today. That's why I think what he's doing is important, but I think everybody needs to be doing that. If everybody was doing what George is doing, we could get more people on that road. We're going to get there faster together. We don't have enough. Even in the Parkinson Disease Avengers, join pdavengers.com, we don't have enough of a grassroots effort. And when we compare ourselves to other diseases, okay, we need many, many more people on this road together. And what could be better than a shared journey? Okay, so I invite the Parkinson community to come on a shared journey. If we want to end disease, this is the path, and we should walk it together and learn from each other.
Thank you. I just want everyone, please also support the doctor. You can see all, and there's so many more. We actually just added a section, as you know, on Together for Sharon on books and your book.
100% of proceeds to charity, to Parkinson charity, by the way.
Excellent.
So,
and they're all listed on our website. And please visit the doctor. He's incredible, not just advocate, but person. I just wanted to thank you again for your time. I know how busy you are, and I mean, like I said, you're always right there for me, and I'm always right there for you. And I again feel we're a family in this fight, and our voices are just so much stronger. And I always say I'm just getting started, even though I've been doing this for a little time like you. Every time I meet someone like you, or yeah, as you meet all the patients, the families, and in memory of all those unfortunately we've lost, we just can't stop till we end this disease. So I just want to thank you, doctor, for your time, your love and support. It means the world to so many.
it's my pleasure. So great to be on and keep up your work. Let's build that road.
Thank you. And this has been another episode of Q&A with Sharon's son, George. Please stay tuned for many more, but without your support, this wouldn't be possible. Please support the doctor. Please support the University of Florida and also all of his upcoming work. And you can find also his information at TogetherForSharon.com. Thank you again, and till we meet again, which will be very soon. So thank you all. We send our love and support.
Thank you.